Good afternoon, everyone. My name is Keith Rourke. I'm a urologist here at the University of Alberta, and today I thought we would go through urinary catheterization. Essentially, today what we'll be doing is learning what a catheter is, why people need urinary catheters, go through a little bit of what the urethra is, and also run through some of the proper catheterization technique, review some types of catheters, and at the very end of it, help you troubleshoot difficult catheterization scenarios. So what is a urinary catheter, you may ask yourself? Quite simply, a urinary catheter is either a latex, polyethylene, or silicone tube that one places inside the urinary tract to drain urine from the bladder. Generally speaking, it's made up of a couple of parts. It's a tube. Most of them have two ports. One is a tube that you use to drain urine through. The second usually has a colorful cap on it, and it's through that you inject fluid that will keep the catheter in place. So, just to demonstrate, if I inject a syringe with fluid or air into this catheter and you inflate it, you will start to notice that this balloon inflates. And as that balloon fills to usually about 10 cc's as a standard, this balloon is what holds the catheter in place while it's in someone's bladder. So that's the basic anatomy of a catheter. The other thing you'll notice is that caps do come in different colors, which indicates the different sizes of the catheters. How we measure the size of the catheter is in a unit called French. And French is simply put the circumference. So a 16 French catheter, which is what this is, purely indicates that the catheter is 16 millimeters around in circumference. And so these caps are different colors to indicate what size the catheter is. They go all the way up to 24 French, which is a light blue cap, usually all the way down in adults to 14 French, which is a green cap, or even 12 French, which is a white cap. So quite honestly, you can look at a catheter that someone has in and know exactly what size it is by simply looking at the cap. So the basic catheter anatomy is there is two ports, one for draining urine, another one for inflating a balloon, and you can always tell the size of the catheter by the color of the cap, which will tell you the circumference around, measured in French. Putting a catheter in, I think, is an essential skill in medicine. Why does someone need a catheter? Well, there's a couple of reasons, and one of the most common reasons is someone can't urinate at all, and we call that acute urinary retention. So in these instances, the patient's very uncomfortable, the bladder's full, and we place a catheter in order to empty the bladder efficiently. The other reason we put a catheter in is for people to have monitoring of their urine output, and that is usually closely associated with the degree of perfusion in their body. So measuring urine output can give you a very good idea of the status of someone's hydration and their overall volume status. The third reason that mostly we urologists put catheters in is for the purpose of evacuating clots and blood from the lower urinary tract. There are some cases where you wouldn't want to put a catheter in someone's urethra, and that would be the unique circumstance where someone sustained a pelvic fracture and has injured their urethra. In those cases, you want to do a urethrogram and assess the status of the urethra before putting a urinary catheter. In basic terms, the urethra has four parts, and these are divided into the anterior urethra and the posterior urethra. The anterior urethra starts at the tip of the penis, and that's called the penile urethra, obviously, then extends into the bulbar urethra, which extends behind the scrotum, and the anterior urethra ends where the membranous urethra and prostate form. So the posterior urethra is the other part, and that's both the membranous, also known as the external urinary sphincter, and the prostate. And those two together combine the posterior urethra. So when it's time to put a catheter in, always ask yourself if a catheter is needed. But once you've determined that a patient needs a catheter, you'll need some equipment. So come on over here. In terms of catheterization equipment, you'll need a set of sterile gloves. In this case, it's not completely sterile. You'll also need a sterile drape set. So most catheterization kits will come with a sterile drape, usually in two parts. Once you have your sterile drape, you'll also need your cleaning solution. In this case, it's a betadine solution. You'll also need lubrication, usually some form of jelly lubricant or other various forms. You will also, of course, need your catheter, and they come in various forms, and we'll review each of those near the end of the video. You'll need a syringe to inflate the balloon with water, and you'll also need, at the very end, a collection bag. And this collection bag is essentially a tube that will hook up to the drainage port of your catheter that will collect the urine. This catheter bag then usually has measurements on the side. In this case, it's not very accurate gradients, but will tell you in general terms how much urine the patient is making. And then, of course, at the very end, there's a little lever for releasing that and emptying it. So that's your basic equipment. In this instance, we have a patient here in dire need of a urinary catheter. So our first order of business after preparing the sterile field is to prep the patient and then prepare for the sterilization part of the procedure. We have a catheter drape, which in this case we'll put over the patient's genitals. And at the very same time, we'll put another one up at the very bottom to kind of create our sterile field. Once you've established your sterile field, you can do this either before or after, is we'll obtain our swabs. And what we will do is then, with one hand, which is now a little bit contaminated, take the swab with the other, and we'll dab it around the urethral opening and the rest of the penis. Now, you don't have to sterilize the whole area, but obviously the part that you will be placing the catheter through. Once you've done this, usually 2 or 3 times, you can place your swabs to the side, and then you can simply grab your catheter, make sure it's well lubricated with all the lubrication that you can get, and then you can start the process of placing the catheter. Obviously, the whole time you're reassuring the patient that everything's going to be okay. When you grab the male penis and urethra, it's very important that the penis is pulled straight up and on stretch, because the urethra has a curve to it. And if you just leave the penis hanging and try and put the catheter in this way, it will be very difficult. So one of the key points is to put it on stretch, pull up to the ceiling as far as you can without hurting the patient. And then subsequently, with your well lubricated catheter and a steady pressure, introduce it into the urethral meatus. And then the key thing is not to grab halfway down the catheter. You want to very firmly, with very short sections, advance the catheter into the urethra, very gently. So about 1 centimeter or 2 at a time, steady pressure. Because if you grab too far back, it's going to buckle, and you won't be able to get the catheter in. So a firm but steady pressure, 1 to 2 centimeters at a time, passing the catheter in through the urethral meatus with the penis on stretch throughout. Once the catheter is in, all the way up to the hub, you can then subsequently take your syringe, insert it into this port, and you can subsequently inflate the balloon with a total of 10 cc's. So in this case, we'll inflate the balloon partly. Then what you can do is sometimes push gently on the bladder to make sure you get urine back. Now, some people will, in fact, prior to inflating the balloon, push on the bladder, make sure there is urine. But then once you know you're in the bladder and the balloon is inflated, you pull the catheter back, you'll feel the balloon pull, and then you'll be able to drain the bladder of urine. When it's time to take your catheter out, you can simply place your syringe, deflate the balloon, and remove the catheter. There are different types of catheters that we have available. In this case, the catheter that we inserted is commonly called a two-way catheter or Foley catheter. This one, just to review, has a drainage port that again you'll hook your catheter bag up to, and the other port, the second port, is to inflate the catheter balloon. Now, in some instances, you can encounter difficulties placing this catheter because of the angle of the urethra at the junction of the anterior and posterior urethra. So there is something called a coude tip catheter. And a coude tip catheter, simply put, is identical to a regular Foley catheter, except for one key difference. And that key difference is a curve. So in this instance, in some men with really big prostates, you can't put a regular catheter in. So you'll use a coude tip catheter with the curve pointed upward and place it down the urethra with the tip pointing up. And that will help guide the catheter up and into the bladder in some difficult catheter scenarios. Another type of catheter that we have is called a three-way Foley catheter or three-way urethral catheter. In these instances, it's very similar. You have a balloon port, and in this case, this is purple, tells you that it's 22 French. You have a drainage port where the urine will drain from, but the key difference is this third port. And this third port allows fluid to flow in to the bladder. So you have a series of ports, one for inflow and others for the outflow. So this is the kind of catheter that we put into the bladder to irrigate blood clots out and then to irrigate saline or other fluids into the bladder to prevent those clots from reforming. So these catheters, as you might expect, are a little bit bigger than the regular catheter. So in this case, this is a 14 French. In this case, it's a 16 French coude. In this case, it's a 22 French, but 3-way Foley catheter. So these are very similar to any other catheter except for the third drainage port, and they're slightly bigger in size. So if you can put a regular catheter in, you can also put a coude catheter in. You can also put a 3-way catheter in. Now, the coude tip catheter is very useful, as I said, for men with prostate enlargement, where you have some difficulties placing the catheter because of the size of the prostate. There are other situations where you may have difficulties placing a catheter, and one of those is somebody has a very narrow foreskin, and the problem is you can't retract the foreskin in order to get the catheter in. Another common scenario might be someone's urethral opening or the urethral meatus is quite narrow, and in those cases you may need the assistance of a urologist to dilate that area open. Another reason similarly would be a urethral stricture, which is a blockage in the urethra, or something else called a false passage. And simply put, in some of their instances, the penis may be buried or may be very swollen, and you may have difficulties placing a catheter in. Some of the catheter scenarios that we commonly encounter in a ward situation is what we affectionately call the self-TURP. And that is where a patient will subsequently remove a catheter forcibly, and that will cause some trauma and some bleeding. In those instances, you can safely place another urinary catheter. So as you can imagine, there is a bit of trauma sustained during that, because if you inflate the catheter balloon to its normal size, and in this case, a 3-way Foley catheter holds about 30 cc's in the balloon, as I'm demonstrating here. So that balloon, when a poor old fella steps on it and pulls it out, it can cause a little bit of urethral trauma. So in these instances, there's a lot of blood through the urethra, but in most cases, you can try to put another catheter in. It'll drain the urine and tamponade any of the bleeding. Another issue that we'll encounter is people will have difficulties placing a catheter after a fairly long distance. So the catheter will go in about halfway down the urethra. In those instances, you should probably suspect a urethral stricture. And then what you could try is smaller catheters. If you're using a 16, maybe try a 14, or even go down to a 12 or 10 French. You might be able to negotiate through that area of narrowing. So if somebody you suspect has prostate enlargement, you can try a coude tip catheter to negotiate through the prostate with the tip pointed up. And in some cases, it may be very helpful to use a larger catheter, because a big prostate may require a little bit more pressure to negotiate the catheter through those large lobes. If the catheter doesn't go very far in before you hit a blockage, you may want to use a very small catheter, like a 14 French. In other cases, if there's a bit of bleeding from the catheter being removed forcibly, placing another catheter is usually no big deal. So in summary, a urinary catheter is an important part of a doctor's job, at least I think, and I think is an important skill for every healthcare professional. We use catheters for things like urinary retention, which help patients tremendously. We also use catheters to monitor the volume status of sick patients. Keep in mind that catheters, for the most part, are very easy to place. Keep in mind the urethral anatomy. Also, now you're aware of the 3 different types of catheters: the regular 2-way Foley catheter, the coude tip catheter, and the 3-way catheter. And keep in mind some of the common difficult catheter scenarios that we reviewed. And whenever there's a doubt, do not hesitate to call a urologist. It's our job.